Hello, I'm Dr. Myra Schmaderer. I'm a nurse scientist and a researcher here at the UNMC College of Nursing. I would like to thank you and thank Dr. Nick Gunzel for allowing me to talk about my path to nursing research. Dr. Gunzel has provided a format for content of this short discussion, so I will follow his guide. I'm very pleased that you may be considering a career in nursing and especially a career in nursing research. So how did I first become interested in nursing? Well, my sister told me not to. At that point in time, my sister, well, she still is a couple years older than me, and she was in a nursing school at the time. And it was very difficult for her. And every weekend when she'd come home, she'd say, don't do this, don't do this. But I ended up doing it as well. I was not one of those individuals who knew they wanted to be a nurse all of their life. I was in my second year of college and I'd taken a lot of science courses, and the harder ones, the biochemistries, the statistics, the hard sciences. And I was paying for my own education. 2 years had passed and I vowed I was not going to be in school for over 4 years. I said to myself, what can I be? Anyway, I ended up making a decision to go to UNMC College of Nursing, and I believe I made a very good decision. So my nursing education path, well, I took the long way, and I'm going to suggest to you, if you opt to do this, is don't take the long way. But anyway, I initially got an associate degree in nursing, and then after a few years, went back, got my bachelor's degree, then after several years got my master's, and then after several years got my PhD. My blood does run very red. All of my degrees are from UNMC College of Nursing. My nursing career has been varied. As most nurses, I started out working in the hospital and I worked on an adult medical surgical unit. After a few years, I transferred to the ICU and was a staff nurse in the intensive care unit while completing my bachelor's and my master's degree. After graduating with my master's, I became a clinical nurse specialist and I was working on the medical surgical floor. After a few years, I became a manager of the progressive care unit and then went back to a CNS role at a heart failure clinic and worked in that role. I started teaching at UNMC College of Nursing, where I have been employed for the last 21 years. I finished my PhD about 5 years ago, and I started being a nurse researcher at that point in time. So my research educational path, my master's program was my real first introduction to nursing research. The first study that I was involved with was a music study to determine if music therapy helped post-coronary artery bypass patients recover from the surgical, helped with their surgical recovery. The next exposure was also in my master's program, and it was actually my research project that I did for my master's thesis, and that was predictors of length of stay in post-open heart surgical patients. This one wasn't quite as fun for me because it was a chart review, and I really like patients. So during my master's degree is really the time in my life where I began to understand research and all of its ins and its outs. After I got a job at UNMC as an instructor, I was only teaching at the time. However, there was always something in the back of my mind that just said, you need to be doing research. You should really be doing research. You like research. Well, it took several years, but I decided to pursue the PhD and dove right into the research. My burning question was, why do some people manage their chronic disease, self-manage their chronic disease so well, and other people do not manage well at all? And so my research dissertation was related to patient activation, which is the knowledge, skills, and confidence to manage oneself, and it was in multimorbid patients. So in addition to the studies I have talked about, I've also had the opportunity to be involved in other research. I assisted with a study called Health Buddy, and the Health Buddy was a device that was connected to patients' phones. This was before everyone carried around a cell phone. A message was sent via the Health Buddy to the patients every day. This was to motivate them, to get them to understand their disease, whatever they had going on, and then also to help them to understand symptoms. Another study I was involved with was to assist in care transitions. And what I mean by care transitions is that first month from when they're discharged from the hospital, we were trying to keep them from being readmitted. So we had a nurse practitioner do a home visit with the patients, and then weekly calls and weekly interaction with the patients. So with the goal to keep them from being readmitted. Most recently, since I've got my PhD, I have been able to obtain funding for 2 different studies. Both are interested in self-management, one in the heart failure population and one in the multimorbid population. I have just finished enrolling and have started doing data analysis in the heart failure study. We have a cell phone app that we give to our patients, and they get daily reminders to weigh themselves. They get an educational tip every day about their heart disease. They also get a Bluetooth scale to weigh themselves so they can monitor their fluid volume status in their heart failure. I'm very excited about this study. I really think it's something that our patients can learn from and self-manage better. We're already finding that it does help some. There are some patients that it really does not help, and they really won't do it on a daily basis. But for some, it really is helpful. The other funded study I have is basically the same concepts as the heart failure study, but this is in a multimorbid population. So what I mean by that is the patient has to have 2 or more chronic diseases that they have to self-manage at home to be in my study. They again get a app that's downloaded to their phone, and they again get reminders to either weigh themselves, take their blood pressure, or whatever they need to manage their chronic disease. They get an educational tip every day and also get reminders to take their medication every day. So for my future research plans, I plan to complete and disseminate the findings from the studies that I have and I'm working on. One thing you learn very quickly when you do research is that whatever you're researching, there's always more questions to be answered. There's always more whys. There's always more, why did it happen this way? What can we do to figure that out? So my plan is to finish these studies, apply for more grants, and with the goal of helping the most patients that I can self-manage their chronic disease. I have a great interest in mobile technology, a great interest in heart failure and multimorbidity. I found that there's hardly a person out there that only has one chronic disease. Usually if they have one chronic disease, they have more than that. So there's lots and lots of future research to be done. So what would I really like to tell you about if you're considering a career in nursing research? Start earlier in your career. Don't wait so long like I did. Be resilient. It takes several times of submitting grants prior to funding. Just keep learning and keep submitting. I think there's research out there that says that you need to submit about 5 grants before you get one. Try to stay on a path, but be willing to change and be innovative. So remember the Health Buddy study that I had talked about, where it was actually communicating by a phone prior to a cell phone. And you think about that, and you think about where we are now and what cell phones are doing to our lives, and how we can have an app for absolutely everything. So I'm just saying is, try to stay on a path, but be willing to change and be innovative. Be very passionate. Whatever you're passionate about is what you're going to do well at. So figure out where your passion is and go for it. And I just want to say that you can do it, and go for it.